We begin at 5 tonight with breaking news in Clark County. Police are investigating a shooting from this afternoon in Washougal. It's in the area of Southeast Sunset View Road and Southeast Evergreen Highway. Authorities say they found a man and a woman both shot in a home there. The woman did not survive. The man is in critical condition. They are calling this an apparent murder-suicide attempt and say that the man shot the woman. We will update you as we learn more. If you or someone that you know needs help, please reach out. You can reach the National Suicide Prevention Lifeline by calling or texting 988, that number right there on your screen. That's the new simplified number to talk with counselors any time of day. Now to our homeless crisis. The mayor met with Portland businesses this morning to outline his sweeping plan to tackle homelessness. Just last week, City Council approved $27 million to pay for it. And as Blair Best reports, today's meeting was a chance for the mayor to speak directly to downtown business leaders affected by this crisis every day.
Mayor Ted Wheeler and Housing Commissioner Dan Ryan broke down this aggressive plan. They spoke to how they plan to try and end unsanctioned homeless camping by the summer of 2024 and explained how they ultimately came up with this plan. On the second floor of the downtown Hilton Hotel and out of Thursday's rainstorm, Portland Mayor Ted Wheeler and Housing Commissioner Dan Ryan spoke to roughly 150 members of Portland's business community about another storm, one that's been brewing on our streets for years.
A significant number of people on our streets are very unwell. We did this to ourselves, and we did it intentionally, with 30 to 40 years of neglect of our mental health infrastructure in this state. It took decades to get where we are, and it's going to take a long time to dig ourselves out of the hole.
One that just keeps getting bigger, in part due to drugs.
So there's a couple of trends that we have been watching, that we have been aware of, that have helped shape our decision to go larger and to be bolder.
Part of their plan, banning unsanctioned homeless camping and putting homeless people into 6 large designated camping sites instead, each equipped with hygiene services and caseworkers, seeing as wait lists for affordable housing are 5 to 7 years long.
And if we truly care about connecting people to services and helping them get off and stay off the street, then they need to be in a location where we have a reasonable shot, we have a fighting chance of connecting them to services.
Mayor Wheeler seemingly letting his guard down while responding to critics of this plan.
And then I have these so-called experts telling me I'm inhumane because I'm asking people not to occupy our public spaces wall to wall. At some point, for me, I'll take common sense over expertise.
Commissioner Dan Ryan weighing in, claiming his Safe for Us villages, which faced their fair share of hurdles and community backlash, were a successful first step in the mayor's broader plan.
Everyone clap for that. Thank you. It's been hell and it's been worth it. I feel like the Safe for Us villages were our baby step in regards to this, so I broke some wind, if you will.
The mayor also taking aim at the county's current leadership.
The Joint Office of Homeless Services, to be blunt, has not been transparent with the city. They have not provided us basic data, financial data that we have requested. It does not feel like a partnership.
Mayor Wheeler and Commissioner Ryan immediately left the breakfast after it ended and were unable to answer any of our questions in person. Now, what we wanted to ask them was where do they plan to put these 6 large designated camping sites, and how exactly do they plan to move the more than 5,000 homeless people living on our streets?
We're concerned about it, I think, as everybody in the community. Where are they going to go? How is that going to affect those communities?
Some in attendance, like Juliana Lukasik with Central City Concern, left feeling cautiously optimistic, especially when it comes to the shortage of workers needed for this plan.
Because until we have a really, really solid workforce around behavioral health, these problems are going to be very difficult to solve.
Mayor Ted Wheeler is also asking the county to delay their budget vote until the new year. He says what they have in place now won't support this plan. He's also requesting a financial review of the county's Joint Office of Homeless Services. Blair Best, KGW News.
Mayor Wheeler also announced this week that nearly all city employees will be required to work in person at least half the time starting in the spring. It's an attempt to bring more foot traffic downtown and restructure city government. But the plan is getting some pushback in this new remote working world. Brian Clerkley spoke to some city workers today. So, Brian, how many people are already back in the office right now?
Hey, Brittany, 60% of city employees have been working in person during the pandemic. The other 40% have been working in the office 1 day a week. A recent study found 68% of Americans prefer remote work over in person. 83% say the shift to remote work has been successful, and 49% of remote employees have returned to the office full time as of this year. Prior to the pandemic, nearly 3,000 city employees worked in downtown offices, and in the last 2 years, there's been noticeably less foot traffic downtown. Mayor Wheeler says some jobs will be fully remote, like customer service or people who process billing statements, but for everyone else, the general rule will be half-time.
I mean, it's expected. Before the pandemic, we were in the office full-time. So I think people just need to get used to coming back to the office. I see it as part of business.
We've been working fairly efficiently, more than fairly efficiently, for a number of years this way. And so it seems to be a slap in the face.
The City of Portland's Professional Workers Union says many city workers have successfully worked from home for more than 2 years. Some would like to continue doing so, while some may prefer going into the office, but constituents do want to say when it comes to flexible schedules. And this new work model also calls for a rule which would need to be approved by the City Council that would require all employees to work from Oregon or Washington, even if working remotely. Brittany?
That working landscape keeps changing. All right, thanks so much, Bryant. The Bonneville Power Administration is investigating vandalism and damage of its equipment at a substation in Clackamas. It comes as threats against the power grid have gone up here and nationally. Yesterday, PGE also confirmed a different attack at a separate substation in Clackamas. The FBI is investigating both incidents. A recent federal memo warned of such attacks in Oregon and Washington. It comes on the heels of the news in North Carolina. Thousands of people were without power this week there following substation attacks. Electricity has been restored, but the search for the suspect or suspects is ongoing. Historic and unprecedented. That's how doctors in our area are describing a surge in respiratory illnesses and the toll that it's taking on our healthcare system. Mike Benner reports.
Things will get worse before they get better.
Dr. Dean Seidlinger is not mincing words. The state epidemiologist revealing Thursday that while the worst of RSV is likely behind us, influenza is not. Seidlinger says flu cases have doubled week after week for 5 weeks. Test percent positivity, he says, has jumped from 1% to 30%. And then there's COVID.
The COVID-19 pandemic is not over, and we're seeing warning signs that COVID-19 cases are quickly increasing this respiratory season.
It's a nightmare scenario for our healthcare system. We're told hospitals across our area are operating at or above capacity.
What's going on in the pediatric world is truly historic nationwide and also here in Oregon.
Dr. Wendy Hassan of Randall Children's Hospital says she's seeing record numbers of sick kids. She and her colleagues are having to get creative just to handle the influx of patients.
ED lobbies are crowded. We are experiencing very, very long wait times.
That's the situation at Providence St. Vincent, but it's the same everywhere, including at OHSU. Just listen to what one doctor shared with us.
My teenage daughter needed to go to the emergency room, and I was sitting there for like 12, 13 hours in my own emergency rooms area.
The crisis at our hospitals due to a surge of illnesses in both kids and adults is not lost on Oregon Governor Kate Brown. On Wednesday, Governor Brown extended an executive order she originally signed in mid-November. Among other things, this will provide hospitals with additional resources.
We expect more than 100 contract nurses and respiratory therapists to be in place in the next week.
While promising, Dr. Dean Seidlinger says this won't fix the problem overnight. He pleads with the public to take precautions.
Wear a mask when you're in crowded indoor places this winter and stay up to date on your vaccinations. Masks work, period.
And of course, cover your sneezes and coughs and wash your hands with soap and water. Also, it is a good idea to be up to date on all of your COVID boosters and really any vaccination for that matter. As Dr. Hassan of Randall Children's Hospital shared with us, of all of the kids admitted to the hospital for the flu, an overwhelming majority of them had not gotten the flu shot. Reporting in the newsroom, I'm Mike Benner for KGW News.
Yeah, such an important update. Well, now to a report that you'll see tonight at 6 on The Story. A teenage girl in Vancouver died from a fentanyl overdose at her high school in May. The school district never told families what happened, and police were not called to investigate. Investigative reporter Evan Watson spent months tracking down these details and joins us now with a preview. So, Evan, what did you find?
Yeah, Brittany, because this information was not publicized, I used dozens of public records requests and eventually conversations with the student's family to work out what happened. The girl's mom and many others say we should know when something like this happens to help prevent another child's death.
Hi, I'm the administrative secretary at Hudson's Bay High School. I need an ambulance immediately. I've got a student overdosing in the bathroom.
The 16-year-old girl was found unresponsive in a bathroom stall at Hudson's Bay High School last May. School officials wrote in a report they found drugs with her they believed to be fentanyl. A school nurse and emergency responders used Narcan to try and save the student's life, but she died in the hospital days later. School officials told students and parents at the time there was a medical emergency and that someone had died, but never said it was due to a fentanyl overdose. Vancouver School District Superintendent Dr. Jeff Snell said schools aren't required to share this information.
When there's a fentanyl overdose at school, wouldn't parents want to know?
Well, I don't know what parents would want exactly. I know in situations that, you know, I think what you're getting at is if there's an overdose, do we just say a student overdosed from fentanyl at the school? I think that we as a school have a responsibility to be thoughtful about that and engage the family of the person that did that in terms of what's disclosed.
There's a lot to unpack in this story. Coming up at 6 on The Story, I'll share my full investigation into what happened around this teenager's death. The story examines why the school district didn't call police the day of the overdose and how that hampered the criminal investigation into this case. I also spoke with the DEA and a drug prevention advocate who talk about how they think school districts should handle these cases and why transparency is so important. Brittany?
Yeah, eye-opening. All right, thanks so much, Evan.